Allen, and welcome everyone to PTACC's Public Safety Work Group Conversation with the Field. My name is Scott Allen, and I'm going to be your host and moderator today, and we're really excited with our Public Safety Work Group to get this panel going. Learning from our prior PTACC conversation with the fields, this is going to be a hybrid of some pre-recorded videos, and then we're going to get right into our live panelists, which we're really excited to do. We really want this to be conversational and to learn and share with one another. So any questions you have, you're going to send them along into the Q&A, and then we will unmute your line so you can ask the questions directly as we get through this. But without further ado, we're going to get right into our first recording and introduction from Jack Chalier.
The conversations with the field, what are they? This is something new, something very exciting that's never been done for our field of deflection and pre-arrest diversion. We're a very young field, but you've got a place where you can come and listen to folks as well as share with others what you are seeing and doing in a wide range of topics. Deflection and pre-arrest diversion, law enforcement, fire, and EMS are working together to connect people who are in need of substance use disorder and mental health treatment into recovery for themselves, for their families, and for their children.
The Public Safety Work Group of PTACC is a group of practitioners within the different fields of pre-arrest deflection diversion within the public safety group. We have myself, a retired police chief. I'm now the chief operating officer for Operating Safe Lives with QRT National. We have amongst our group my co-chair, Melissa O'Mara, who is a prosecutor in New Jersey, who works intimately with the drug courts. We have corrections represented at the table. We have collaborative partners, practitioners in our group from all sectors of the public safety field. Within the past year, we reorganized the Public Safety Work Group to focus on specific areas that we wanted to promote through PTACC. And we came up with 3 focus areas, including the law enforcement and behavioral health partner collaboration, which is critically important in this field of pre-arrest diversion deflection. Our second focus area is on creating equity. We encourage all public safety partners to embrace a culture of inclusion, fairness, and opportunity for all as it relates to this work of creating safe communities, in particular with pre-arrest diversion deflection. And then our third focus area is on authentic community engagement with partners and stakeholders. When we talk about engagement, there's a lot of great community engaged programs out there, but in our work, our focus area with this group, we really wanted to get to the root core of authentic community engagement, not just providing services or offering services to a community, but asking the community, what are your needs? What are your vulnerable populations? And how can we work together to come up with a solution, within this pre-arrest diversion deflection area? So today we have 4 outstanding panelists who are working on the front lines within each of these focus areas. And we're really excited to have these guests and to let them share the work that they're doing in the field, but then also to have you, in our audience, engage in this discussion so that we can learn from one another, share with one another, and hopefully enhance and build upon this public safety work group that we've put together, through PTACC over the past year. Go within PTACC, the public safety work group had, not been as actively meeting and, had a collaborative approach. So what we did is we looked to our partners within PTACC and recruited, a core group of practitioners. And again, we now have 6, actually we have 8 or 10 practitioners on a bi-weekly basis. We're now meeting as a work group to focus on these core areas so that we can exchange ideas that will bring value back to the field of pre-arrest deflection diversion. In particular with this, panel that we've put together, we all utilize our networks of those that are in the field to bring these partners to our table. So our goal with the public safety work group, because when you think about it in PTACC, the P stands for police. And again, when we say police, I'm a former police officer, retired chief of police, but I like to say first responders, because it's not just police alone. It's police, it's fire, it's EMS, it's all of our partners working collectively, collaboratively with our community partners and stakeholders, the recovery community, the corrections, jails and prisons. There's such a diverse, community of, public safety, that we wanted this public safety work group to be reflective of that diversity, which is why we've really enhanced. And now on a regular basis, we're meeting with one another and sharing what we're learning from one another. Our goal for today is to learn and listen from our 4 panelists. We have one representative for each of our 3 core focus areas. We're going to actually have 2 partners for the law enforcement and behavioral health partner collaboration. We have a assistant fire chief who is engaged in a proactive QRT, quick response team model out in Ohio, alongside a leader in the recovery community, establishing a recovery center out in New Jersey. So we're going to have those 2 panelists within our focus area 1, and then our panelists within the equity and authentic community engagement collaboration. We're going to hear from them what's happening at the grassroots. Not only what are the positives in what's working, but what are the challenges and what are the barriers within each of these focus areas and on the front lines. What are the challenges today? Obviously, we've had a lot that's happened in the past year between COVID and racial equities. We want to make sure that we're bringing all of those diverse groups to the table to learn from them, but also to learn about those barriers and challenges, and then to learn from our panelists. How did they overcome those obstacles? We are excited to get right into our first panelist. Just a quick housekeeping. If you have a question, please send it into the Q&A, and we'll definitely look to call on you after we get through the panelists. We'll try to get to all questions. If we can't, we'll make sure that someone does get in touch with you after the presentation. And with that, we're going to look to our first presentation, Daryl Mcgraw, who I've been fortunate to have met over the past couple of months, and really excited to hear Daryl today. So without further ado, we're going to hear Daryl's video, and then we'll move along.
In the battle to improve public safety statistics in our communities today, the most effective ambassadors are those who come directly from recovery, the court, police, fire, prison, EMS, from all walks of life, through the conversion experience into inspired service. According to the Connecticut Mirror, accidental drug overdose deaths tripled in Connecticut between 2010 and 2018. With the proportion of overdose victims with prior involvement in the criminal justice system slowly increasing during that time. According to research published in Newsweek, people who get out of prison are 40 times more likely to die of an opioid overdose within 2 weeks of their release than those who haven't spent time behind bars. Meet Daryl Mcgraw.
Since George Floyd happened, I was appointed to the Police Accountability Task Force, and some politicians thought, oh, I would be great to be on this task force, and I said, yeah, well, great. And then I didn't know that they were appointing me to be the chair of the task force, right? So I show up and I realize that I am actually the chair. So now there are all these police chiefs and police officers in the room, and I'm directing this ship, which only God does stuff like that, because talk about God having a sense of humor. Here I am, I was running the police, now I'm running the police.
It's been said that $80 billion each year goes to dealing with addiction and the crime that often accompanies it.
There are so many communities that have been ravaged by the crack epidemic, and we're still not whole. I realized how much addiction, drug use, was the common denominator for me going to prison, right? Or coming in contact with law enforcement. drugs, whether I was going to buy them, using them, somehow there was a direct correlation. So I said to myself, if I take drugs out of the equation, what will my life be like? And so far, by the grace of God, I haven't been back in a prison. I've been in prison several times. I run a lifers group inside, and I've been running that for the last 4 years. I mentor people. So, I made a promise to many people inside. I said, I'll be back, but I'll be back through the front door. I got arrested May 7, 2007. It wasn't pretty, officer pulled me over, DWB, driving while black. And, he pulled me over and, one thing led to another. He said I was on my cell phone, but in the end, he ended up choking me on the side of the road. And that led to me, it was a negative experience. But what happened after that, I ended up going to Hartford Correctional, West Wing, 25 cell. And I'm in there, my bond's $250,000, and that's not my normal MO. You know what I mean? Normally I'm a PTA type of guy, release on your own recognizance, show up here on Monday, but $250,000, my bond was $250,000 or whatever, and cash. And I was in some serious trouble. I'm in a single cell and a guy comes by and he says, "Hey, Daryl, I got this book I want you to read." And he came by and he slipped it under my door, and it was Rick Warren's Purpose-Driven Life. It's a 40-day spiritual journey. My court date was 41 days away. Now, I love God, I believe in God, but this was a little too scary for me. 41 days away, court, 40-day spiritual journey. So God must want me to read this book so I could go home, because I think God's a bondsman, right? So of course, I'm going to do this. I'm going to read this book. I start reading the book and it says every chapter you read one day for 40 days. So I start writing, I'm being faithful. I want God to see that I'm paying attention. Every day I'm writing a line or two, but by day 26, a transformation started to happen. And I started to read more and start to see, wow, I started to see that this was something. So I started writing more. And then by the next thing I knew, I was writing pages and pages of things that I wanted to change. I wanted to change my character, because if I changed my character, certain things no longer became acceptable, like smoking crack or running from the police or all of that stuff. So I started writing. And before I knew it, I had 3 notebooks full of, things that I wanted to change. And that was the beginning of my 5-year plan. Day 40 came, and I'll never forget. I was in my cell. I had finished the book. I had all these notebooks. I had all these notes. And I had literally a transformation in my brain and my thinking. And I said to God, God, man, I want to go home, but if it's not your will, then whatever, because you know what? Through that time that I was in that cell by myself, I had found purpose. And my purpose was to take my story, my journey, and use it as a tool to guide others out of darkness, to show other people the light, kind of like a modern day Underground Railroad. People are in darkness. When I was in addiction, every day, daylight, at night, it was dark. So how do I use this story as a tool? And the next day I went to court and the judge gave me 4 years. And my lawyer cried. When your lawyer cries, it's pretty bad, right? He cried and he's like, "I thought we did a really good job. I'm sorry I let you down." I said, "You didn't let me down. I'm ready. I'm ready to go." And I went to prison, and I've been this person who I am today, who you see today. Every day of that bid, I was just giving back, trying to be there. God, who can I help? How can I help? How can I do this? What can I do to help? Whether it be a good word, whether it be just listening to somebody, how can I help people transition or at least get closer to their goal of recovery, being fathers, being mothers? Yeah, some people would say get closer to God. Of course, I would want that. but my goal is really to get closer to being a human being and finding that source of strength like I did, which for me was God, but for others it may be something else. And I'm really just guiding them out of light, out of darkness. And that's what it was. And I went to prison with that, on that mission, and I've been on that mission ever since. We try to work together to try to prevent negative interactions with communities and police officers. How do we have open dialogue? And how does everyone go home safe? How does the police officer go home safe? Because I know some police officers who, and everyone says their first mission is to get back home to their family. Well, you know, as a Black person in this country, when I walk out the door, my mission is to get back home to my family. And it shouldn't be like that, but it's a reality in this country that I can walk out of here just in this brown skin and not make it back home. So it's important that we start to have those conversations, and hopefully we can do that in our work nationally and in our states. And I was great opportunity to be a part of this process. I didn't know it existed, but you know, I'm so glad that it does. You know, these stories, you can't make them up. June 10th, 2015, I was sitting in the mortgage office and I started to fill out, you know, the mortgage form for my first house ever. I started to sign the date and I sat back and said, oh man, I didn't realize today what today's date was. And the mortgage guy and the lawyers are like, what's wrong? I was like, I got out of prison 5 years ago today. And they looked at me and they were like, congratulations. Like they didn't know how to respond to that. But those that know how significant. I was literally on a prison bunk 5 years ago today, and here I am sitting in my house. Parents and wives, loved ones always want what's best for the person. But if that person doesn't want that, I said, you know, at some point you're going to have to draw this line and you say, you know what, I'm here to help you, but you don't get to make me watch you die. You don't get the luxury to do that. And it's hard for people to say that, but we get free choice. We get choice. We don't get the opportunity to decide what the consequences are. The treatment methodology was different, right? It was incarceration. They were locking people up. You're a drug addict, you go to jail. Now the message is, we can't lock our way up out of this. There's a lot of work to be done on a lot of sides, you know, interactions with police officers. You know, we had 2 pandemics going on. We had this race relations, we had COVID, we got all this stuff going on. And then people are still dying at high rates to opioid use disorder and all these different things.
Wow, Daryl, thank you. I mean, every time I hear you speak, it's certainly inspirational. You know, Daryl, you know, we know that in order to build equity in diversion or deflection programs, you've got to establish trust in the communities. You know, with your experiences, what would be the first thing program coordinators should do to build that trust and to start that trust building process?
Thanks, Scott. Thank you, PTACC. Thank you for inviting me. I watched the video. I'm like, who's this guy? You know, but you know what? I'm definitely happy, honored, and pleased to be here, you know, on this journey. You know, I thought about this question a few times, and I thought about, like, how do you make it simple for people to understand? You know, when you're going to someone's house, you're a guest, right? As a guest, right? So it should be the same as if you're going to a community. You're a guest. So you don't walk in someone's house and go in there. Well, I don't know everybody on this call, but I don't go into people's house and I don't go in the refrigerator and kick my shoes off and go upstairs and make myself at home or start barking out orders. What I do is I come in and I'm welcomed into that environment. I sit down and I'm treated like a guest. And, you know, we have conversations and we start to become friends, right, through that relationship. And I think that that's what's missed a lot of times when communities, especially disenfranchised communities, and for this conversation, we'll be talking about Black and brown communities, right? People go in with really good intentions, but they don't go in to tap into the natural resources that are in those communities, right? You need to identify champions that are in the communities, and I'm excited for us to talk further about this, but identify champions that are in the communities and making those connections to places that people frequent from the communities, and then bring your ideas to those individuals and let them introduce them to the masses, not coming in saying, we got this great program, you guys are gonna like it, and we're gonna do this, because when you think you are coming to help somebody, you can actually do more harm than good. So that's where I'm gonna stop at. I'm excited to be a part of this conversation. Let's go, man.
So, and Daryl, just the follow-up to that before we get into Kristen's presentation is, you know, you hit the nail on the head. You've got to find those champions, but they got to be involved from the start in those communities, correct?
Yeah, thank you, Scott, 100%. You know, a lot of times what we do is we invite people, and I myself have been invited to the table, but just to be at the table, we want them to be a part of the conversation, not just at the table, part of the structure building. You're gonna need those assets at the table. And a lot of times people will come into our communities, right? And they'll say, oh, we got this great, but Daryl, come along, I want you to come, but you don't really want me to do anything because you already have this mindset. And really quickly, I'll just give a quick example if I can, is, you know, we see a lot of, like, we used to see a lot of projects in my community, right? High-rise buildings, and they had all of a sudden someone came up with this great idea, tear the projects down, give everybody Section 8 and move these people to different houses, like houses or in the suburban areas. What they didn't realize going into that, no one asked the people what they wanted. On the third floor was Mr. Joe, who fixes cars. On the fifth floor, I could borrow money from this person. On the second floor, this person watches kids. So when you tore those buildings down, you didn't just tear a physical building down, you actually tore down communities. So now these people who had natural resources, who depended on each other, no longer have that structure. And that's just a sample of how people, without the knowledge of how certain communities work, they came in and just dismantled and disrupted all these lives with the idea of doing something good. So I'm excited and to hear my fellow panelists, and looking forward to this robust conversation.
Yeah, awesome, Daryl. And for those in the audience, if you have questions, send them into the Q&A box. We're going to open up the floor shortly when we get through the other three presentations. And without further ado, we're going to jump right into Kristen Cushman-Smith from Project Clean in her presentation.
How can we bring you in and make it easy for you to step out your front door? With an open air market, you have sort of this discouraging of enjoying your own home. You can't go outside your front door because there might be a drug deal going on. You can't let your children play in the snow because there might be needles in the snow. And so, you know, you have all of these issues of really just trying to enjoy your neighborhood. And the way that everything has been set up makes it very difficult. I'm Kristen Cushman-Smith. Our program here in Rochester, New York is called Project Clean, which stands for Community Law Enforcement and Assistance Network. We started in 2017. Our organization works in a neighborhood that is mainly Hispanic. Our neighborhood is the El Camino neighborhood in the central city of Rochester. It's been a Hispanic neighborhood for, I want to say, probably maybe 50 to 60 years. It has historically been the immigrant location within the city. During the Great Migration of the 50s, all the Puerto Ricans came, and so we have a huge Hispanic population here in the city. My organization, Ibero-American Development Corporation, works in the El Camino neighborhood. We are actually a housing development organization, so we're kind of an outlier when it comes to BCGI projects because we aren't a law enforcement partner or a government agency. We do affordable housing. We're building 104 units right now in the El Camino neighborhood. My department, the community engagement department, does a lot of work specifically regarding the open air heroin market that is in the El Camino neighborhood. There's always been heroin here in the El Camino neighborhood, but it didn't really become the exacerbated open air market until about 2015. That's really when the opioid crisis started to really ramp up here. And the county itself wasn't even collecting overdose information until probably late 2017. We didn't really have a lot of place-based information about how saturated it was until we were starting to count. Then we were finding it was pretty significant. And the proximity of the market to the main thoroughfare through the city, which is Clinton Avenue. So there's this long-standing historic market. There's easy access to this location from major thoroughfares all through the state. And it becomes sort of regionally known as a location to easily score heroin. The majority of the population using in the target area is actually from outside the target area. We do have users in the target area who are of the population of the target area, but we have a lot of visitors because our population in the target area is majority, it's like 53% single African-American women, and overwhelmingly it's, middle-aged men. 70% in the target area was like 35 to 45-year-old white men who don't live in the city. In 2012, 2013, the mayor of the city came through and knocked down like hundreds of vacant homes and these properties that were just becoming zombie properties. So you sort of traded one problem for another. When you have vacancy and you have this lack of eyes and ears to sort of monitor the situation, you have people sort of running amok. So there's all this vacancy in the target area, and there's a neighborhood who's essentially become accustomed, unfortunately is the word, like the amount of use that goes on in the area is so regular that they become sort of normalized to it, and which is obviously victimization of the people that live in the neighborhood. So it had been law enforcement policy straight from the district attorney's mouth was, we do not chase drugs. So the policy of the law enforcement in the area essentially discouraged this, like following up on the offenses that were going on in the target area. So you'd get all these residents calling about drug dealing and all this activity going around their homes and needles. And you get a law enforcement agency who is unresponsive, like we don't chase drugs. And so we have this perfect storm of vacancy and apathy on part of the residents in the area, and law enforcement having this no hands-on approach to handling the open air heroin market, and it just exploded. So the county started counting at the end of 2017. And even then, it was probably another year until they had sort of agreed on a way to count them for all the partners like across our region. It took some getting used to, but right now the way that we count overdoses here in our county touches with law enforcement or emergency services. So it is I would call a soft number. We're not collecting information from actual users who are overdosing. These are individuals who connect with an ambulance or a police officer, and that entity captures that there was an overdose that occurred. In 2018, there were a total of 1,133 overdoses in our county and city. Of that percentage, 8% occurred in the target area, and that's close to 100 overdoses. In 2020, there were 723 total overdoses through our county, and only 5% of them occurred in our target area. So that's about 36. So we have data that our interventions are working. We know that in our hotspots too, the concentration of overdoses is also going down. It's not just merely the number. One of the things that we currently track is how often a location pops up as an overdose location. So if there is repeat location, like we have one vacant house that's always been a problem, and then we try to take that vacant house down, and then a new one happens. And so we sort of watch these locations become sort of regular locations. in our target area for 2018, 49% of our overdoses occurred in repeat locations. So these are like galleries where people are shooting up a lot. Through all of our work, we've been able to reduce it to 19% for 2020, which is tremendous since it's actually going up in the city, not including our target area, and the county, not including our target area. The homes that are currently in here, the homes that currently occupy a lot of the location are below the value in which you can qualify for a mortgage in this area. So you only attract certain sorts of individuals. There's one street that has like 5 houses on them, and 4 of those 5 houses are owner occupied, but there's space for 40 houses on that street. So you really just have this dichotomy of space. But again, it's an inner city neighborhood. So we do have a large population of renters, which are a difficult population to engage specifically around issues like this because of the transient nature of it. A lot of our community engagement is with owner-occupied owners of homes in the area because obviously they have the buy-in.
Thank you, Kristen, and a lot that we're going to talk about with this topic area. Let me ask you this: with most people in the pre-arrest diversion deflection programs, they have an awareness of the importance of community engagement. However, and I think you hit on it in a couple aspects. We see a lack of movement in this area in some regions. What advice would you give sites that are attempting to move from talking about this engagement, authentic engagement, to the actual implementation of an engagement plan?
Thank you for having me, first off, and great question. So what I would start with is it's really about not talking about it anymore. It's really about putting your boots on the ground. One of the things I really like to focus on is I'm not the audience, like the folks that I'm trying to reach. I'm not the audience. So I really need to consider a lot of different things, a lot of different strategies. And when you think about your audience, it's not just where they are, but who they are. So again, I deal with a largely Hispanic population for my project. So I have to make sure that all of my materials for my project go out in 2 languages. And a lot of that requires, a partnership within my organization. So, my organization is a largely Hispanic organization, and we have those tools within the company itself. And so language access, making sure your message is said correctly to the specific audience you're talking to is also really, really important. I think Daryl brought it up earlier about working with organizations that you trust, and Hispanics are historically a very trust-based community. And so you really have to go out to the places where they are. Like, you are not going to do community engagement from behind a desk. Like, that's just not how it is. And so, you're going to have to go to a church meeting, or you're going to have to go to a community center. So you're going to have to meet them where they are. And the last thing I'll leave you with is that not everyone's going to want to come to a meeting, and not everyone's going to want to talk to you either. The variety of activities in which you choose to engage people in is really important, because you're not going to just call a meeting and get all your block captains to join. You may not necessarily need your block captains. You might want the guy who knows how to build benches, but he might not come to a meeting. So you really need to have a variety of opportunities to engage through different activities as well.
Great. And we're going to come back to this topic as well, because what I'm hearing from you, Kristen, is, and we hear this all the time, I wanted to set up a program. It's going to look different in different places: urban, rural, suburban, East Coast, West Coast. I mean, there's different trends. So, this is really, I know we've already got some questions piling up, so I will get to those questions from our audience But before we do that, and make sure you keep those coming on there, I want to get to our next presenter, Rich Alexander from Burlington County, New Jersey.
It's a big awakening to go out to a 911 call and to meet someone either at their home or at bedside in the hospital or on the side of the road, depending on how, the situation, and, running into someone who just had Narcan and, they were dead an hour ago and someone revived them. So it's a whole different thing. And there's so much that you learn. The only way to learn is right there on the court. I'm an entrepreneur. I want to help entrepreneurs in recovery. So that was my first thinking. But then I got into advocacy. And what was good is in my training in the past, I dealt with lawyers and doctors and regulatory people. So I really wasn't fazed when put in front of people in those situations because I was just used to that already. I spoke in front of budget committees and really helped them have some aha moments during some big change in New Jersey when Governor Christie signed a lot of the bills into laws. I was home one day and Melissa called me. Unbeknownst to me, she said she was working with the Burlington County Prosecutor's Office. I think the time I had seen her before that, no one would hire her as a person in recovery looking for a job in a prosecutor's office. She said that they had a grant and that they were looking for a project manager. And so I was very interested. What we do is provide a peer recovery specialist to 911 calls. We have first responders as peer recovery specialists. 911 call comes in. If an officer deems it appropriate, they dial our hotline, and we have a peer recovery specialist on call 24/7. It didn't immediately start that way, but that's where we are now. Eventually, last July, I got myself trained for peer recovery specialist. I was leading for a while, and then when I went out myself, it was a big awakening. We work in a county, and our operation is led by the prosecutor of the county. He hired Melissa. I give him a lot of credit to put someone in charge that's in recovery and that is also an attorney and a prosecutor. It's just brilliant. And so Burlington County turns out is the largest county in the state. It's like 820 square miles. So it's humongous. There's 42 municipalities. There's about 450,000 people there. So we're working with the 42 municipalities to try and, to have them call us. So someone who overdosed or has any type of issue with substance abuse or substance use, we want them to call us. And then we get a recovery coach to come out. The recovery coach responds. We give them 6 weeks of recovery coaching. We have a lot of data to capture once they agree to work with us. And then if they're looking for placement into treatment, we place them into treatment. In the middle is all those police departments who decide to call us. We've done training for EMS, 5 minutes to help. Sometimes EMS, we've learned they have compassion fatigue, as it's called, and we're dealing with the same people over and over. So there's been training set up for that to help them, and in that training, I think, I got to sit in when Melissa was doing it with another assistant prosecutor, and we had one person bringing up data that sometimes the officer turns out to be the only person who talks to the person who has this incident. And so what'll happen is they'll have an incident, they'll get Narcan, the EMS comes, and they put him in the bus, and he's, the officer's in, and I bang on the bus as they go, and they think I did my job. And he says, but then I learned later, they got to the hospital, and they ran. And they decided they don't want to be at the hospital. So it turned out that the officer was the only person who talked to them. And so they want to take that time to let them know what's available and try and get them a coach and try and get them to hold on till a coach can show up. Because when a peer recovery coach shows up, it's a whole different story. So many times it's like, thank God that they have a coach because they have to hang on for 3 days. How do you hang on for 3 days? It's not like they're going to stop doing fentanyl for 3 days. It doesn't work that way. So it's a big challenge. I think a lot of the law enforcement realized, and, we sat down with a few judges, and, the judges, they know, that putting someone in jail, they've been doing it for 26 years, 30 years. They know who's showing back up, and that isn't solving the problem.
Thank you, Rich. I've got a bunch of questions, but we're going to go right to this one. So you're considering partnerships with police departments, and you hit on that key part about police departments and police. What have you noticed as being the most challenging part of that work? And what advice would you give sites that are still trying to work through those challenges? Because we know not all police departments have embraced the pre-arrest diversion deflection. So what advice would you give to sites trying to work through those challenges?
Well, first, I'd like to thank you all for letting me be here and be on this great panel. And yes, we work closely with police and, law enforcement, and, it can be challenging. And what we've learned is that, I remember the sergeant on the team explaining to us, the officers who call are the ones who care, right? So if they called you, it's not because they don't want to participate, it's because they think they can make a difference. And when each of the officers call and they get a peer recovery specialist, they're dealing with someone who's representing the recovery community, and they get to meet us and learn that we're part of the community and we're making a difference. And we consider each of those interactions as like a teachable moment. And we let the officers, and it depends, I've studied change management, so it depends on where they are in the change curve. They could say, this is my first call. I've never called. What am I supposed to do? Or sometimes they call 2-3 hours later. And it's like, it doesn't work that way. And so we have to teach them. We want them to call immediately because, people are gone quickly and we can't find them. So we use that teachable moment. And, we have to also understand that they're overwhelmed. So we have to, and they're securing a site, and there's safety, and they're responsible. So we have to be, work with them closely. But I think we learned early that when the best teaching is when they call someone out, and it was like one of our first 5 calls, and we've had over 300 calls we've done over the last 2 years. And, they told the coach, well, the person really isn't interested in help, but I figured I'd call and have you come in. And so the coach came in, the coach asked the officer, if they could step into the other room, and the coach went in and spoke with the person. Well, the officer conveyed, 15 minutes later, when they hear the 2 people laughing from the bottom of their bellies, that something's happening that they can't do themselves. And so that connection between 2 peers is just, it's just that. It's just a connection that only peers make happen. And so that's when they really learn. That's when they have that aha moment, and then they'll call again. Or they'll tell the people they work with, or they'll tell their sergeant or their lieutenant.
Great. Hey, Rich, and just on that, because we talk about that front row seat to this crisis, this behavioral health, substance use crisis that's going on nationally. But, law enforcement knowing by making that referral to your recovery, the teams that have that expertise and lived experience, but by utilizing that front row seat, law enforcement can collaborate and then take that step back, is what you're saying, and let the expert take over?
Yeah, and, I think they call it, and some of them, have dealt with it personally. You learn, it's like, oh, we've heard from this officer 6 times. And then I happened to be on the call with him one time, and then he explained to me that his sister had passed away 5 years ago. And he just wants to help everyone. And, I was talking to someone the other day, and they talked about, these programs are worth it. If we just help one person, it's all worth it. And, I guess there must, there's something deep in that statement, but we want to help every person that needs help. We don't want to miss anyone. We want to help every single one. And some officers have bought into that too.
Great. Well, thank you very much, Rich. And we'll be circling back real quickly. Again, keep those questions coming in the chat box. We're gonna probably need 5 hours to get through all these discussion points, but without further ado, we're gonna have our last presentation from Chief Will Mueller, Assistant Fire Chief out in Colleran Township, Ohio.
2014, we became keenly aware of the increased number of overdose responses that our public safety entities were having. We saw a stark increase ranging from 51 overdoses back in 2012 to 116 overdoses in 2013 to 141 overdoses in 2014. To become a little bit more educated on the real scope of the problem, as opposed to just pretending that we knew what addiction was and how it could be better treated from a community-wide standpoint, we began to have conversations with those in the addiction world, and we began to ask questions about what are some of the biggest problems that are leading to this building and growing epidemic. And we learned through many discussions with those who are much smarter than us in the world of addiction that there are two prevalent causes that had gotten us to where we were. Primarily, it was the prevalence of narcotics themselves, and then a lack of connectedness to resources. Simply put, people just didn't know where to go for help once they learned that their child or their loved one was actually addicted. So we realized that a good entry point for us from a public safety perspective was that of getting people connected to resources. The whole thought process became then, how can we better get people connected? You know, what's the problem with getting people connected? There's 800 numbers all over the place. So why are people not just calling numbers to try to get help? It's not so much just about not knowing those numbers or not knowing where to get the numbers. It's past bad experiences with people not being able to get help once they do call. And so we decided that we wanted to create a model that would eliminate barriers. And those barriers being stigma, those barriers being time, transportation, lack of connectedness to medical resources like Medicaid, all those, the financial barriers, the medical barriers associated with trying to get into recovery. We learned that there are certain medical conditions, underlying undiagnosed medical conditions, that can stop people from getting treatment. Those need to be addressed first. They need to be discovered. They need to be treated. They need to be healthy in a place where they can then be successful in treatment. So we decided to try to develop a model that addressed all of those barriers. And instead of waiting for somebody to call a number for help, we would bring those recovery resources directly to the doorstep of the individual and the families in need. And so that became the premise then for what we called this very early pre-arrest diversion model called Quick Response Team. And so the concept we began in August of 2014. And it took us about 9 months of development, implementation planning, training, addressing legal aspects to actually get the feet in the street in July of 2015 when we conducted our first post-overdose follow-up. Once the overdose follow-ups began in July of 2015, it didn't take us long to understand how important this model was to the community. There was some very large successes right off the get-go, right out of the gate. More success than what we really even anticipated. When we started having this conversation with the addiction community and our partner agency then at the time, Addiction Services Council of Cincinnati, their CEO, Nan Franks, had said, you know, if we get 10% of the people connected to recovery resources and engaged in treatment, we're going to do awesome. We're going to do great. And we blew that 10% out of the water very quickly, very early on. And within the first several months of the program's inception, we were making face-to-face contact with about 75% of those individuals who had overdosed, and then subsequently getting about 72% of them, again, early on in the first several months of the model, getting 72% of that number actually engaged in treatment or connected to recovery resources. The model was very well received in the addiction community. Word spread very quickly. And so we began running two races. One of those races was to continue to improve, evaluate, and enhance our model. And the second one was educating other communities who had heard of those successes and wanted to duplicate that model. And so those two races were kind of kept us hopping for the years to come. We quickly realized that quick response team was an entry point, but we also realized that we needed to create multiple entry points for individuals suffering from this disease of addiction, and to get them connected to recovery. It's not just a simple one-pronged approach, but rather a 360-degree approach with multiple ways that individuals could get connected to recovery. Quick response team was one of those for sure, but it was only at that time going out once a week and following up with the overdoses that occurred the week prior. We knew we were missing some individuals. We knew that we were missing some key opportunities. Some of those opportunities were, we realized that people were actually dying from the time that their initial 911 call overdose occurred to the time the quick response team got out to them. And simply put, that delay in that time frame, they were overdosing a second time or a third time, and they were dying. There was definitely a gap that needed to be bridged there from the time that the overdose occurred to the time that the quick response team could get there. And so we needed to bridge that gap with naloxone leave behind. On our overdose calls, when somebody was a suspected opiate-related overdose, we would leave them a Narcan kit furnished by a great partnership with Hamilton County Public Health. And those Narcan kits, rather than being an enabling device and giving people a licensure to use again, was meant to be life-sustaining. If they were to relapse, which we know relapse is a part of this, and go back to using again between the time that we were there with the call and the time we got there with the quick response team, they had a Narcan kit that could help keep them alive until we got back there. So that was one of the gaps that we realized we needed to bridge. The second one we identified was the time that we connected them with QRT to recovery resources. There's another time gap. A lot of our individuals, we could get connected same day. Some people were not as lucky. There was a waiting period. Then needed to bridge that gap with another Narcan, perhaps, if that first one was utilized. Keeping people alive throughout this entire process was something that we really needed to look at and to see how we can make that happen. The Narcan leave behind was that answer. We also realized that not everybody is in the right frame of mind to talk about recovery. And right after the 911 call and the overdose reversal, for many people, it's not the best time. So that's why we bring the follow-up piece to that with the quick response team, right? However, even when the quick response team gets there, it doesn't mean that, because it's not necessarily scheduled, we're just knocking on doors and making phone calls. These aren't scheduled visits. These are impromptu visits. And sometimes we catch people in that right frame of mind. Other times we do not. So we needed to create another opportunity for when someone decided they want recovery resources or they want to seek help. We kind of refer to that now as the golden second. And so we've got a very small window of opportunity to capitalize on that decision. And so what we did is we made 5 of our coal ring fire stations what we call safe stations. And it was a program adopted from Manchester, New Hampshire. And so what we decided to do was to open up our doors. When someone decides that they want help, they can come to any one of our 5 fire stations. They don't have to wait for the quick response team to get there. They come to any one of our 5 fire stations, and it is a safe place. It is safe and free of stigma. We're not going to judge. We're not going to bring in law enforcement. We're simply going to medically assess them, get them connected to the necessary recovery resources, furnish them a Narcan kit if necessary, if they don't already have one, so that we can bridge that gap from the time that they come to our safe station to the time we can get them connected to recovery. So the whole idea, so when you asked about the trajectory, that became just trying to develop this 360-degree approach, trying to create as many entry points to recovery as possible.
As a chief that's coordinating QRT teams with fire EMS, police, and peer recovery specialists, considering those partnerships in these different deflection programs, how critical is it for police and fire to partner and work together in this behavioral health space, if you will? What are the challenges on bringing police and fire? I mean, police, fire, everyone loves a firefighter because you guys always save the day, and the police not necessarily always there for the best of circumstances. But how do you bridge that gap in that partnership, Chief?
Sure. And you mentioned it well when you said the model, which may not have been presented in the video, but the model that we run is a 3-person team. And that is a law enforcement officer, a firefighter, paramedic, and then of course the addiction expert, the peer navigator, peer support specialist. Many places call them something differently. So that team of 3 did require a lot of partnership and a lot of collaboration. So how critical is it? I could answer it and just say very critical. It's the backbone of our program. However, I will go on to say that none of us is smarter than all of us, first and foremost. So, secondly, there's a trend in healthcare now, which is bringing interdisciplinary approaches to health concerns and health issues. And this QRT model is an exact example of this. We find that these innovative interdisciplinary approaches are being successful for the first time in decades. We're tearing down silos and partnering with agencies, even from the healthcare perspective, that we've never worked with before. If you would have told me 20 years ago that we would be riding today with law enforcement and a peer support specialist, I would have said you were crazy. Those things they were unheard of. So it's really important in the sense, if we want to bring the proper care to individuals, it does take that collaborative approach. The second part to that is information sharing. So when we're working with these agencies, all the information that I have isn't of use to the quick response team. All the information our law enforcement agency has to the Corrine Police Department isn't completely useful to our agency. And without our information, our addiction partner has no client base, right? So it's really important because we bring the client base, they bring the resources, which brings me to, I guess I'd say my next point is that each individual on the team has a very specific, job-specific role. Law enforcement brings the safety piece to it. They bring the supply reduction piece to it too, right? Not only on the quick response team are we utilizing that opportunity to get people connected to recovery, but we're also using that opportunity as a means to gather supply reduction information, all right, which becomes kind of part of an investigation. When you're there with such a high level of trust and individuals know that we're not there to arrest them, we're there to help, people start talking. They start singing like little birds about where they got, where they get their supply and things like that. So our model is both harm reduction and supply reduction model. The firefighter paramedic is there for the medical assessment. Law enforcement, the addiction side, they can't provide that. So we provide that medical assistance because we're there to remove the medical barrier that often exists, like I mentioned in the video. And then of course, none of this would be possible without our addiction partners, right? We would be doing the same thing we're doing over and over again if we didn't have them on board. So when you ask about how critical, it's the backbone of our entire program. Now there are barriers and there's challenges to that, to which I would be able to offer some advice. Some of those barriers being that some agencies, whether they're interagency, police and fire, they don't get along. Oftentimes they're competing for budgets and everybody thinks that Corrine Township Police and Corrine firefighters, they work together all the time. They have great partnerships. Now in our jurisdiction, we're very blessed for that. But in other agencies, it's simply not the case. So when you're trying to create a model that brings these interdisciplinary approaches together, and you have agencies that don't cooperate, that can be a real problem, right? And they're competing for money, they're competing for budget sometimes. And the other barrier is sometimes, like you mentioned before, Scott, that culture within one of the organizations just doesn't exist. From a fire perspective, if I want to bring this model to the table for our jurisdiction to consider, and police says, no way, we're not going to do that, there's another challenge. So advice, I think that brings me to the last piece of that, the advice. Where do you start with that? Where do you go with that? Never be afraid to have a conversation. Never be afraid to fail at a conversation. And so I think there's a lot of apprehension when we go out to other communities and present this model. Right off the bat, we get our police department, they're not going to go for this. I don't know. We can really ask that. Don't be afraid to have the conversation. And second and foremost, I would probably say, if you don't feel that those relationships are strong enough now, start building them right now. The best time to plant a tree was when? 25 years ago. When's the second best time? Today. When's the best time to start those collaborative relationships? It was 25 years ago. When's the second best time? It's today. So start those conversations today, start building the relationships today, and that is going to go a long way in future endeavors.
That's great, Chief. You just kind of laid the groundwork for my first overall panel question. But before we get to that, I do want to have, we've got one of our attendees, Terry Cole-Smith, has a question directly for you, Kristen. Terry, want to ask that directly. I want to make sure you get your information from Kristen direct.
I'm coming. It just takes my computer a second here. Hi. Yeah. The question was for Kristen. When you were talking about your numbers, the OD numbers going down, and how you were successfully sort of moving people out of that target area that you were talking about. My first question was, are these ODs, and really this goes for everybody, I guess, when we're talking about ODs, some people survive ODs and some people die. So that's part of my question. And then secondly, do you have data on those folks that you're seeing no longer in your target area? Are they getting into recovery or into rehab, or are they just moving someplace else? Thanks.
So, yeah, no problem. Thank you for your question, first off. So I have data on both fatal and non-fatal overdoses. I was talking total, so that included both fatal and non-fatal when I was giving them. So our, quite unfortunately, our fatal overdoses stayed the same from 2019 into 2020, but our non-fatals went down. And regarding your question for what's the follow-up into treatment? So a couple different things. Our numbers are sort of at the very front of the interaction. I'll say that. So gentleman has an overdose, ambulance is called. The EMT might log that there was an overdose, that they distributed Narcan, and then the gentleman may have either gone in the bus or not. So that is the end of where my counting is merely that first touch with EMS or law enforcement. Now, it was great to hear about Will's success with getting people into treatment with a holistic model, because that's really what we are hearing in the field is really the way to get people. To your question about getting people into treatment. So one of the things in our neck of the woods, in our area, we have two huge hospital systems here. And there's been a significant push to see what the follow-up is. So if those individuals do end up going to one of the hospitals, what happens to them after they go to the hospital? And at this point, there's not a lot of information, unfortunately. And across the county, we've worked to sort of increase the resources within the hospitals themselves, because there had been a long-standing practice. I'm sure other folks will understand this when I say it, which is treat them and street them. So quite unfortunately, there was not a lot of follow-up or really a lot of empathy going on in the hospital systems for the folks who were getting to the hospital after they were overdosing. There is one officer in all of Monroe County who works for the Sheriff's Department, who does what are called overdose follow-ups. Now, these are done with the victims of non-fatals and their families 2 to 3 days after the overdose. It does not happen in the city of Rochester. It is exclusive to the surrounding suburbs and towns. There has been some local move to increase the resources to individuals overdosing inside of the city limits. But as of right now, there's not a lot of really great data other than the providers themselves saying people are checking in within a certain amount of time after their overdose. And that's about it. So they're not doing a really great job of counting.
Thank you, Terry, for that question. And thank you, Kristen, for that response. And I think we can circle back on that, because I know with Chief Mueller and then maybe with Rich, or maybe I'll throw it right back to Will and Rich right now. What have you seen for the successful engagement? Because I know in our county, we had some real good engagement at these visits. What have you seen for either the numbers or the successful engagement connecting people to care? I'll go to Rich first, then how about Will? And then I got a question for Daryl.
Well, what we've learned Terry, is that a number of people that, that join us, if we get a chance to talk to somebody, almost in the 80th percentile, they'll agree to see a recovery coach specialist or peer specialist. And then, and those interactions can be on, two different ends of the spectrum where we actually, although they agreed, we never speak to them again. And then there's the other end where we're speaking to them every week. And then when our 6 weeks are up and they want to keep talking to us, which we accommodate too. So, so it really, and I think the leaders really buy into that when they see that 80% they accept coaching. They sign a form that says they'll talk to someone for 6 weeks. It's very surprising. And then of those, out of all the people we talk to, about 40% go to treatment, and which is another high number, right? So it just shows what the peer can do when they're right there, right in front of the person. And so, those numbers, they continually speak for themselves. Although COVID has, reduced a lot of the call outs, we went through our first full winter of doing 24/7. So, December and January, everybody's asking, what are we doing wrong? But, the calls are picking up again as people come outside and it gets warmer, and we're getting the calls because we want the calls, like I had mentioned before.
Thank you, Rich. Hey, Will, before I go to you, Daryl, with these, so we have those are some great numbers, and I can see, I've heard similar numbers, experienced those, but how do we make sure that these programs are equitable, that we get those similar numbers in the populations of individuals of color in the development of these programs? What has your experience been?
So I think that, I love the numbers, and, I wanted to say something to, I believe it was just really quickly, Terry, I appreciate, thank God that, your son made it through that overdose. I just wanted to acknowledge that space for her. And thank you for sharing that. Prayers will be with you and your family. What we have to do is a lot of times, like something similar to what Kristen was saying and what Rich and everybody is saying, when you have these coaches, the people that are entering into these communities, they should mirror the people that are there. Right? There should be like, because that's where the connection comes at sometimes, and there could be the disconnection, right? Send a white coach into an African American neighborhood or his, Latinx community, they may be perceived as police and trying to arrest more so than help. So sometimes, to be equitable, you want that because sometimes people feel a lot more comfortable working with, just like women, people bringing women, we encourage that you bring in LGBTQ people. We need to be able to meet the people that are out there that need the help. The helpers need to reflect those individuals. So we like to see that being mirrored. And sometimes it's difficult, but it should be something that we should strive for. And, I say it's difficult, but I hear a lot of programs saying, oh, well, we never can find the people. Well, they're there. And if you ever have a problem finding somebody, let me know, man. I'll come to your hood and I'll find them for you.
Hey, Daryl, on that, and I know in the work that we did with our teams, what we found is, they were police involved with peer recovery specialists. They built this bond that they would try the first location, but because they were so committed to it, they would take those follow-ups and steps, say, hey, let's check another place, or let's check with the local homeless, group in town. So it really, you could see the teams built up those relationships in the network that they would go above and beyond. And for Terry, I'm sorry that your son wasn't connected. And I think one of the things we've always talked about is with these diversion programs, deflection programs, is filling those gaps, making sure that no one gets missed to the best of our ability.
100%. And going into this and recognizing that nobody woke up in the morning saying, I want to smoke crack or I want to shoot dope. You know what I mean? This is like the worst time of your life. And I love what the chief said, where, they called it the golden second. Well, we call it a window of time. And we need to know how important that minute is. When someone says, I'm ready, we got to have connections. We got to be able to make a call. I don't care. I'm calling my guy. Hey, I got a guy. He's ready. And we need to be able to make those transitions seamless, because that window or that golden second is never open long. So we got to have, those are the most important connections we have. When someone says they're ready, getting them into the treatment at that time is essential.
And on that, just if anyone in the attendees, you have a question, please get in that box. Will, I'm going to redirect back to you from what Daryl just said. That window of time, in your experience, what is that? And everyone's always saying, what's the the magic recipe? What's the best window of time that you have seen in connecting with vulnerable populations, post overdoses, connecting with family members? What does that window look like out in Ohio, or has been for your teams?
So here's the beauty of it: we haven't found it, and I honestly, Chief, I don't think it really exists, because each individual is so different. There are individuals that have come right out of an overdose reversal with Narcan, and they said, I'm ready right now. I need to go right now. And they were serious about it. And we've had people who haven't been ready for weeks, given, multiple relapses in time. So many people are just different. And that's what's unique about, I think, our program, is that we really meet them where they are. Once we follow up and we make contact with them, we don't just give them the one opportunity. We stay in contact with them, and we keep calling back. We check on them. Our police officers may, if they're in their beat, they'll drive by and stop by and say, hey, just following up just to make sure everything's okay. Our medics will often do the same thing. They'll drive by and they realize they made an overdose the week before, and they just want to stop by, and it's about relationships. So when you say, what's the best time frame? There isn't any, but you know what the best opportunity is building trust and relationship.
Yeah, Chief, I'm so glad that I directed that to you, because that was an incredible answer, because you're right. Everyone is different, in a different place, a different time. And to your point, it's not one of these, hey, this is a one-shot deal. We're going to come out one time. We're going to continue to come out and offer you that helping hand. And if you're not ready, no worries. But when you are ready, here we are, ready to help you. And I think that's really what I have found when the deflection programs across the nation are doing, is it's just offering that helping hand when you're ready. Mom and dad, here's some information to arm you to be better educated, so that when your loved one's ready, you'll know how to connect to care. I'm going to push this one out to the entire board, and we're going to start with Kristen. And we've talked about it a couple of times. Chief just hit it again. Is what's the most important component to building these strong community and stakeholder partnerships in your experience?
Humility, being humble, I guess. I always like to tell people that, we're not the experts. We know the experts. Back to the first question, what's the difference between talking about engagement and what's actually doing engagement? I think, I've been in meetings where I could make no one happy. I could make no one happy. And that's going to happen when you do this, because there are times that because everyone's coming to it with buy-in, and you, unless you listen to them, you're never going to know where their story is. So you have to have a little of humility, a little humble attitude about it. Because you are definitely going to be wrong, and that's okay.
It's a great answer. And it comes down to is sometimes is, I laugh about it, who's in charge, who's the decision maker, whose name is the first on the letterhead. And I've been there, seen that, done that. Rich, what do you say on that? What's the most important components to building these partnerships?
I think, we spoke to it before. I think it's the trust. We build the trust with law enforcement so they can deal with our community. And so we show up when we say we're going to show up, and we communicate, and we respect the scene. When they tell us if they tell us midway not to come, then we don't come. In the beginning, we did, we had someone show up when they were told turn around, and so we had to learn a few things. But when you build this trust in the police departments, then the magic happens. We had recently. I was called out, because I do go out on calls personally. And, as most people know, this isn't a lucrative business. So, I'm going out personally. And so I go to a call, and the officer explains to me that the gentleman that was there had wrote a letter to the judge saying he needed help and didn't know what to do. And so the judge gave the letter to his someone in his police department, and then that police department called the police department in this gentleman's town, and then they went out on a wellness call. And then on the wellness call, then they called me. Like, I can't, you know, I'm a great project manager, but that was not by design, right? It's like the magic that happens when you're out there and building that trust in the community. And one thing I want to say, you know, talking about numbers, you know, we just learned recently that, you know, the overdose deaths in our county are down year over year, while one of 4 counties that is in New Jersey where the overdose deaths are down, and is down like 15 deaths down. Like, that is amazing, you know, to get a new trend. It's just amazing. And, you know, like I said, we want everyone, but it's just a great feeling, and we're not stopping here.
Great. It obviously in these times, you know, there's not always a lot of positive news, but to share the positive is really, you know, reinforces why we do what we do. Daryl, to you, what do you think the most important components to building these strong community and stakeholder partnerships is?
I mean, man, I love this panel, man. Everything is great, man. And, you know, but we talk about, like Kristen was going there, we're talking about humanity, we're talking about Chief. The Chief's talking about, like, and Rich is talking about, what we're talking about is treating people as humans, right? But you know what the Chief hit on was real key. You know what, when you start to show people that you care, right? Those little check-ins, I might be going to buy a bag of dope, and then somebody drives by and say, how you doing? How you doing today? That might be the little thing that shifts that thought, right? Like, wow, you know what I mean? That little thing, like, oh man, the cops are watching me. Even so, like, but it's a different relationship. And what we need to do is start really building those different relationships, those check-ins, those conversations. Like that was what Rich just mentioned was beautiful. The cops didn't have, I'm a chair of a police task force in Connecticut. So we like to hear the better stories versus, we always hear the negative stories about police officers, but that was a lot of police interaction that the police probably got no recognition for, nor did they probably want that. But that thing is so huge because that builds trust within the community. It doesn't mean that the police are coming here always to arrest or to, you know, create disruption. More so, they're saying we are part of the community too. And when you start to do that and you start to create these relationships, because that's what they are, relationships, then you're building trust. So trust is always number one. Humanity, treating people as people and not as, you know, addicts and frequent flyers. Language always matters, all these things. But that community partnership and that buy-in, and actually the one thing that I will have to go back to say, number one overall is listen. You know, especially if you are a white person going into a Black or brown community, the number one thing you can do first is listen. Because what happens is we come in, and I say that sometimes it can be challenging for our law enforcement because they're trained to control the scene, right? They're trained to control the environment. So to see an officer come in and step back and say, you guys are the experts, that's huge. Because usually it's do this, shut up, sit down, I'm taking you in jail. Nope, hey, we're here to hear you. And when you say that to a community, that's a whole different level of engagement.
No, that point spot on, you know, Daryl. Hey, Chief, because you had really kind of laid the groundwork for this. What have you seen, or what have you experienced as those that building that trust, building that strong community relationships and partnerships? Because you hit on it a couple of times.
I did, and you know, there's a couple of different ways we can approach this. You know, when we look at partnerships with our own agencies or with those agencies necessary to put together a follow-up model, you know, a lot of our discussion has been surrounding the relational piece of it, and that's so huge, and that's got to be the center, and it's got to be the focus. But you know, there's another side to that. When you're starting to build relationships, is you need to look at and discuss from the administrative side now, right? What's the ROI here? What's the return on investment? What's the benefit of this for our agencies here? What are we really doing? And I don't mean that from a personal, I don't mean that from a gain perspective. I mean from a community support perspective, right? And so, you know, let's first and foremost, let's remind ourselves why we're here. If I'm going to sit down and talk with my partners that I want to engage with and collaborate with. I'm going to say, hey, why are we here? Let's whiteboard this thing. What are we here for ultimately? Why did we get in this profession? Secondly, what does our mission statement say as an organization? Right. And then you throw up that mission statement and say, well, it says here that, we're an all hazards response community committed to developing socially responsible programs. Like, wait a minute, stop. Did you say socially responsible program? That's in your mission statement? Well, that just happens to be what this is. This is a socially responsible program. So you kind of throw that terminology around, and you begin to get people to think a little bit differently. And again, I got to remind you, I'm talking about the administrative side of it, right? Of course, the relational things are most important. But those are the things that we found are very successful in getting people to start to think, oh yeah, you know what, I didn't really think about that. We can talk about crime reduction. We can talk about reduction in the number of responses, and all those are great. We can talk about the number of potential exposures to hepatitis C and HIV that is a reality when we're dealing with this epidemic. You can talk about all those things too, and those things really hit home. But sometimes it's just a good reminder of like, hey, why are we here? We have, I think in the fire service and in law enforcement, we have followed the path of culture, and culture is very me and very self-centric. And so our fire and our professional trade services have started to follow down that same path. We dipped back for a while into self-preservation mode. So it becomes more about our agency and how are we going to keep ourselves safe, and we got to keep our people safe. And yeah, of course, absolutely. But it's time to step outside of that self-preservation mode now, because our mission statement says that that's what we're supposed to do. This is why we got in the fire service. This is what we got in the law enforcement, because we want to help people.
Great.
And that first rule of helping people is knowing that you don't always get to pick the ways that you help people.
Thank you very much, Chief. We've got about 8 more minutes here. So if you have a question from our attendees, please, chat that. I'm going to go back. I'm going to start with Kristen. We've heard a lot of some positives. Let's talk about the challenges. What in these pre-arrest diversion deflection programs, our public safety work group engaging with our behavioral health partners, our partners with lived experience. What's the biggest challenge or challenges, Kristen, that we're confronted with daily that we could share with our attendees?
So let's talk post-COVID. We'll talk post-COVID first. So getting to people is probably one of the most difficult things that I can think of right now. When COVID hit, our team completely changed what we were doing. So we had been doing, regular weekly flyering and, Black Club meetings and connecting to, the youth for like through sports leagues and things like that. And suddenly none of that existed anymore. And so, our modes of connection changed. We were doing almost daily food box delivery. And so we transitioned from this sort of event-based connection to folks through meetings and things like that, to sort of these very, very quick interactions with folks, and the ways that we could give them the information sort of changed. Something that we honestly struggled with was language. Our county produced countless documents about COVID and what was safe and what people could do, but it was only in English. And so, our population had no idea what was safe. There was no information in Spanish about, multiple, washing your hands and things like that. And our agency had to write them. Our agency took over for our county, translating all of the information about COVID. And so there was suddenly a need to make sure information was going out in Spanish when it clearly hadn't been for almost 2 to 3 months. I think one of the things, the biggest barrier is that with COVID, thinking outside of yourself has gotten really difficult. So like I said earlier, when you think about the audience, when you think about the people that you're serving, you can't use yourself as the model. Like, I have regular access to internet. I can use my cell phone. I can order groceries. Like, those aren't necessarily the same capabilities of the folks that I serve. And so I need to make sure that I get to them differently. And so I think, you know, for post-COVID, it's definitely language. Language is a huge deal now.
Great. Daryl, to you, biggest challenge. We're probably going to go around the table on this last question. The biggest challenge or barrier that you've seen, experienced, that is out there right now in these engagements of law enforcement, public safety, and behavioral health, connecting people to care.
So the biggest challenge, and I really appreciate the question, and I would like us to really think about the social determinants of health, right? So there's just such a bigger picture than just the drug use. The drug use is just the piece of it. Like, I'm reaching outside of myself to make myself feel good. Until we start talking about the reasons that people use, trauma being number one, and then poverty, unemployment, right? You know, Kristen was talking about one house and the next house goes. A lot of reasons. There's some people in that neighborhood that don't want that drug seller there, but there's also so many factors that, you know, within that society or that norm that's going on. So there's so much going on. This is why there's so much drug use. And until we start really looking at all categories, from education to housing, employment, and all these different factors, that reasons why people use, right, and start addressing those issues, we're always going to have these mass problems, right? And then when you come in, and when people, service providers come in, they are not looking at that. It's easy to look at the drugs. It's easy to look at the drugs and try to give people MAT or put them in treatment. But until we look at the real issues that people use, we will always have these problems.
Yeah, great point, Daryl. I mean, you know, we talk about, you know, those social determinants of health. That's a term that I just learned in the last couple of years, but that better understanding of trauma, the ACEs study, adverse childhood experiences, you know, you're spot on. We got Rich and Chief Mueller before we wrap up for today. Rich, what biggest challenge or challenges, barriers that, you know, to these programs, you know, engaging at-risk populations?
Well, we, you know, I think there's numerous challenges, and one of the challenges we did face, though, was cultural, and you know, in Burlington County, we had found that the recovery community was not big, and there wasn't a lot of advocates, and I was part of advocates throughout the state, and I remember calling people like, who are the advocates in the county, and we really couldn't find them. So when we started, we had to start with people from out of county, and it really didn't reflect the cultural makeup of the county. And so that's where we started, and we got going, and it took over a year to all of a sudden to reflect. Maybe it didn't take that long, but right around a year till we started reflecting, you know, the cultural makeup and the diversity of the county. And unfortunately, you know, we don't have deep pockets. So, you know, I think it's the big thing is to, if you want people to be culturally inclusive, you have to do it yourself, right? And then show that to the world. And that's what we're doing. And so when we have, you know, the different people on our team responding to calls, you know, you're going to get what you get, you know, so you're going to get somebody different if you're dealing with us, you know, you're going to get someone who represents the community in one way or the other.
Great. Hey, Chief Mueller, last word on biggest challenge, barrier?
Yeah, and I will be brief because I know want to be sensitive to time. Two things, sustainability and consistency. So we build these programs, and we have funding sources that ebb and flow sometimes, right? I think Rich said this is not a lucrative business. And so funding is always a concern when we're talking about sustainability, but consistency. And so that's maintaining team morale. That's keeping up with the latest trends, looking to make sure that we don't become stale as a team, because it's redundant work, because we are going out and we're doing the same things over and over and having similar conversations over and over and over, even though situations are different. So for me, that's a real challenge as you know, leader of the team. And so I want to continue to keep people engaged, continue to look for new ways to train, to come up with new ideas, to improve. And so those things, they all add up. Yeah.
Well, thank you very much to Daryl, Rich, Kristen, Chief Mueller. Thank you to the FRN for hosting today. I hope everyone found this valuable and useful. And just thank you for your time and have a great weekend. And we'll look forward to seeing you at the next conversation with the field.
Thanks, everyone. Stay safe.